Dr. Andrew Reibach, who is an emergency medicine physician at St. Clair Hospital, just down the road from Temple Emmanuel. It is wonderful to have him with us and wonderful to have all of you. So Andy, the first question I would ask you this evening, how are you doing? It's been a wild and crazy couple of days, couple of weeks. How are you feeling?
I'm doing well, thank you. I feel great. No fever, no cold.
I'm delighted to hear that, as we've kind of broken that 6 feet distance.
I'm hunkered down with my wife in the house and going to work and the grocery store, and that's pretty much it. So
very good. So a question for you before we even get started. What is the medical world calling this thing? COVID-19, coronavirus, NC 4718. What do we call this for the duration of our conversation?
So it's a coronavirus, which is a class of viruses that are very common. I would say 1/5 of the colds a person gets in a year are due to a coronavirus. The average child in school gets 10 colds a year, so they probably have 2 coronavirus infections. The average adult, because they built up some immunity, gets probably 5 or 6 colds a year, so they have 1 coronavirus infection. This virus, it goes by COVID-19 because they didn't want to label it
where it originated,
Wuhan virus or China flu or whatever. It's the other name for it, SARS-CoV-2. It's related to the previous, quote, SARS epidemic in that it can involve the lungs in people that are predisposed to getting sick from it.
So I guess that explains why we're hearing the word novel coronavirus to separate it from these others. COVID-19, is that good shorthand?
That's what I refer to it as, is COVID-19. It's
wonderful. Thanks. So what are you guys doing at St. Clair? What are you doing to prepare yourselves, the hospital, the emergency room?
So that's a great question. The short answer is a lot. We have a task force. We have a task force that involves the leadership of the hospital, medical staff leadership, nursing leadership. They develop protocols for how we deal with patients that come in that say, hey, I want to be tested. I've been in Italy. They deal with patients that come in that are ill, that might have symptoms that are consistent with COVID infection, which is basically flu-like symptoms. They provide us resources in the ER, our protective equipment. I've heard a lot on the news that there's a shortage of protective equipment. There doesn't seem to be at St. Clair. Whenever I need a mask, whenever I need gloves, whenever I need gowns, they're on the door and ready for me to use. They're in constant communication with the Department of Health. They're getting updates, and they pass that information on to us at least daily, sometimes 2 or 3 times a day, depending on if their protocols are changing. They're developing certain areas of the hospital, should this become a crisis, to put these patients, particularly to separate them from the other patients that we would try not to expose. So we're doing a lot at St. Clair to manage an event should it happen.
It's wonderful to hear. You mentioned some symptoms, flu-like symptoms. Where's the threshold? I'm not feeling well. I've got a little bit of a fever. We're getting into seasonal allergy time. What are you looking for? How does one determine this is general run-of-the-mill cold, this is novel coronavirus COVID-19, this is a stomach bug?
So the short answer is, if you have a runny nose and a low-grade fever, you might have COVID-19. You might have influenza. You might have rhinovirus. You should stay at home and take Tylenol if you have a fever and over-the-counter cough medicines, push fluids like our moms told us to. The reason to seek care is if you're sick, and by sick, significant respiratory illnesses. If you're short of breath, if you're having chest pain, then you might have coronavirus, you might have pneumonia, you might have flu. as well. In those cases, you should come into the emergency department and seek care. But if you're just having cold symptoms, whether it's caused by novel coronavirus or flu or RSV, stay at home and try to avoid people is the main advice I would give to you. If you're having shortness of breath or chest pain, come in and see me, and we're happy to take care of you.
Wonderful, thank you. I'm sitting here with Dr. Andrew Reibach from St. Clair Hospital, just down the road from Temple Emmanuel, asking questions about what we need to know from an ER doctor about COVID-19, the novel coronavirus. I'm so glad that you are joined with us this evening. Please feel free to use the chat box to begin asking those questions you wish I was asking. And then at the end of our program, we'll also get a chance to go back and forth using this technology of Zoom. And I'm so glad you're all with us. Andy, there's so much news in the world. You know, one of the things we're doing on Sunday is bringing in a psychologist to help us through the anxiety. For those of us who are 24/7 news watchers, it's easy to get pretty wrapped around the axle here. But it's somewhat hard to ascertain what is news and what is noise. What are those pundits who are either not intentionally pushing false narratives, but who are trying to fill time in the 24-hour news cycle? What do people need to know? What would you consider news from this day and age? What are those things we should be doing? What are those things we shouldn't be doing from a healthcare provider rather than from a TV pundit?
I've actually been watching the news, and their advice is similar to what I would give. They're saying that you should socially isolate yourself, which means don't go out to restaurants, don't go to crowded places, avoid big gatherings. This is a virus like all other viruses, and it's going to come through our community. I'm not sure what percentage of the people in the country will get it. My bet is somewhere between 20 and 40% of the people in the country will get it. On the cruise ship, which is basically a giant petri dish, 22% of the people on that ship in close proximity got it. So that's kind of a number that I'm looking at to get it across the country. The good news is of that, those people that get the illness, that have symptoms, about 80% of them have basically a cold. They have runny nose, maybe a low-grade fever, some sore throat, and cough. Those people in a period of 7 to 10 days will get better without any medical treatment, without any long-term complications. They're not going to get any permanent damage to their lungs or the heart or the kidneys. But 20% of people who are symptomatic will get severe disease. They'll get disease, and those people will have symptoms of shortness of breath, chest pain, cough, maybe confusion, those kinds of, they look ill, they are ill, and you will know your family member or yourself is ill by those symptoms. Those 20% of the people should seek care. There's a lot we can do to support them through their illness. They oftentimes will need hospitalization, and oftentimes will need very intensive care. Of the people that get infected that we know that have symptoms, somewhere between, unfortunately, 0.7% and maybe 2% will die. It's not half of them, it's not zero. Those people tend to be in at-risk populations. They'll be, I gotta be careful here, older, which they say is 60 or older. They'll perhaps have, or if you have underlying significant medical conditions, severe heart disease, lung disease, if you're on immunosuppressives for your Crohn's disease or your rheumatoid arthritis, if you're on prednisone, if you have diabetes, if you recently received cancer chemotherapy, those people, my advice to you is to stay inside and try to avoid going out as much as you can, because you are at risk for getting significant illness if you're exposed to the disease. So those people everyone needs to be careful, but those people need to be particularly careful. So it's not, Armageddon, but it's something we need to be careful and watch for.
What's the most outlandish thing that you have heard? Is there something that you heard by somebody purporting to be doing right where you're like, no, don't do that? Or are news outlets more or less getting this one right?
I think, I watch the news, I think the news outlets are getting it right. They're saying, if you don't have to go to work, if you can work from home, work from home. I have to go to work. If you run a pharmacy, you have to go to work. If you run a grocery store, you probably have to go to work. Those people have to go to work. Otherwise, there's going to be catastrophe. But if you can work from home, avoid big crowds and those kinds of things.
A wonderful question coming in from our chat feature right now. And I would encourage everyone to use that chat window to submit questions in real time. How does one differentiate when should you be talking to your primary care physician? When should you be going to the ER? What's that balance in care in this more emergent situation?
So if you're concerned you have COVID-19, if you're having cold symptoms, sore throat, low-grade temperature, but aren't having severe symptoms, and then that's when I would be calling your primary care doctor. They may say, don't worry about it, or they may say, let's get you tested. They can arrange for testing. There's several places you can get it. I think the old Southside Hospital is now opening up testing as of today. But you do need to get your doctor to arrange for you to go get tested. If you're gonna come to an emergency department to get tested for COVID-19, we ask that you do call ahead, because we don't want you in a waiting room. Fortunately, St. Clair doesn't usually have people in the waiting room, but we will escort you back to our special rooms. If you're coming in specifically for COVID testing, if you've been to Italy, if you've been to Asia, if your relative has COVID and you feel like you need to be tested, do call ahead and let us know you're coming in.
Say more about the tests very quickly, right? Are there enough? Aren't there enough? How are we in Allegheny County? I've heard nasal swab. I've heard, what does it consist of?
So the COVID test is both a nasal swab and a pharyngeal swab. Some people will try to get a sputum sample. We're not very successful at getting that very often. It means you have to cough up a big loogie, for lack of a better term. But the nasal swab, I don't know if any of you had the flu swab before. It's the exact same procedure. It stings for about a half a second. And the throat swab's like a strep culture. It's nothing. So the testing is very minimal, minimally invasive. It's safe, not horribly uncomfortable. I would say this answer has changed over the past several days about the availability. 2 weeks ago, I would say there was no testing. 3 weeks ago, no testing. Now I think there's probably adequate testing. People at our facility are getting tested, and the tests are getting sent off. There's other facilities that have the testing that you don't have to come to the emergency department or the hospital or even your physician's office to get. The old Southside Hospital, it's available there, but you do have to have your doctor sort of arrange that for you.
Wonderful. Where do you look for information? You mentioned that you're getting frequent updates through work, but where else are you looking, or where would you encourage us to look?
So I use a website called Up to Date. It's for physicians. It's written by medical experts. The information on COVID-19 is written by infectious disease specialists. It's written by epidemiologists. It's very dense. It's got a lot of statistics. It's got a lot of medical literature cited, but it is updated fairly frequently with the latest information.
And that works. We are all medical experts, at least according to Facebook.
It's a pay service, so I have this. That's where I get a lot of my medical information from. There's also the CDC website, cdc.gov/COVID-19, is updated frequently and gives you all the up-to-date information on where people are infected, what to do to protect yourself, etc.
And on that subject of protecting ourselves, you've already said it, but would you restate for us just what you think the general population should be doing right now? Where's that balance between, man, do I need that haircut now, to, well, wait, I do need groceries? Where's the line?
So COVID-19 is spread by droplet, person to person, just like the flu. So droplets don't go more than 5 or 6 feet. So if I sneeze and you're more than 6 feet away from me, you're not going to get my sneeze in your mouth, nose, or eyes. So I would recommend staying away from people 6 feet. I would also, droplets can get on things. So I would frequently wash your surfaces, your computers, your kitchen counters, the counters in your kitchens at work, etc., with disinfectant. I would wash your hands frequently. If you inadvertently pick up the droplets from a surface, then if you wash your hands frequently with soap and water, 20 seconds, get in between your fingers and your nails, then that will kill the virus and you're less likely to inoculate yourself. And then if you keep your hands away from your eyes, nose, and mouth, or your face, then you're less likely to accidentally pick up a droplet from a surface and self-infect. So those are the major things. I think right now, until more information comes out, it's reasonable to avoid crowds. I actually wanted to get a haircut today. My places weren't open, so I think that's being decided for us. I would say a good rule of thumb is stick to takeout and pick up for restaurants if you're going out, or grocery store and pharmacy and your doctor, and that's pretty much where I would go right now.
Wonderful. So anybody who didn't feel like we should take a short break to all go wash our hands after hearing that description, right? We've got some hand sanitizer right here if you're so in the mood. You're a hand washing pro. You do this millions of times throughout the course of your career. Any favorite songs, any favorite tips to make sure that you are doing it right, that you're doing it for long enough?
No.
Like, just keep doing it. You'll get better at it.
Should be at least 20 seconds. And soap and water, warm water, or these kinds of products with the 62% alcohol will kill everything that we're concerned about these days.
Wonderful. Thank you. That's my last question for you, and one that is on all of our minds as we are spending more time with family than maybe comfortable, or maybe rediscovering family and routine in our lives. Any sense of timeline and trajectory? Where does this thing go from here?
So I would say, from what I'm reading on the medical websites, 3 to 6 months. Counterintuitively, the longer the better, because if it's stretched out over a longer period of time, that means our resources are less tasked, meaning there's more beds for you to get into the ER quicker, more ICU beds for you to use if you get significantly sick. Also, that gives us more time to come up with medications. There's a lot of research going on right now on medications for this. And more time, hopefully, to come up with a vaccine. I think they're starting a trial today as we speak on vaccines. So hopefully, if we stretch this out long enough, we can get people vaccinated and prevent illness.
Wonderful. Anything else that I didn't ask you or anything you want to add before we open it up to questions?
I can think of this.
Wonderful. Well, I'm so grateful for your joining us. We're so fortunate to have, as a member of our Jewish community here in the South Hills, Dr. Andy Reibach of St. Clair Hospital has been answering some questions. You know, for me, it's wonderful to have somebody that I can ask, and hopefully the questions that were of interest to me are of interest to each of you as well. But now would be a great opportunity, either using the chat feature, or if you want to, at this point in time, unmute yourself so that you're able to ask a question. That's the advantage of our getting to do this using Zoom technology. Fire away. Is there anything on your mind that we didn't get a chance to ask this evening? So while we're waiting for questions, those who are joining us from a telephone connection, you're going to hear a moment of silence. That doesn't mean that this call is ending. I'm going to take that to mean we've answered many of the questions that are on your heart as well.
I have one. Can you hear me?
Yes, yes, indeed we can.
Easy. How long? I read various things, and I actually haven't asked my husband. How long will it live on a surface? If you're sharing a desk with someone and you come in the next day, somebody borrowed your desk. How long have you? Do you know that answer of how long the?
Sure. So if you're sharing a desk with somebody, if you're working your way through public spaces and door handles and drinking fountains, how long might COVID-19 live on a surface?
I don't know the answer to that question. It will certainly die if you take sanitizer and clean it. It's probably hours to days, but it's certainly long enough that you can likely catch it from a worker's station if it's not clean.
Thank you.
Great, thank you. We have a question. The World Health Organization wants tests to be even more prevalent, and yet should asymptomatic people get tested? Is it better for those who are healthy and not in a vulnerable category to just ride it out and stay at home and not get tested? Who should get tested? When should they get tested? Why is there a disconnect in the information we're hearing?
So I guess it's what information you want from the test. If the question you want is to reassure ourselves that not the 0.7% are dying, if we test everybody and find out that everyone's infected, and then the denominator goes up and the death rate goes down, it probably makes us feel better, but probably doesn't really change how we should behave. We should try to not catch the illness or transmit it to other people. I'd say if you're in a household that has people that are at risk, getting tested if you have minor symptoms is very reasonable, because you want to especially try to avoid the people at risk if you're infected. But the fact is there's probably not enough tests to test people that are completely asymptomatic, and the information we get if you're positive might direct therapy and isolation if you are sick. So we're probably there's a balance between testing everybody and only testing those that are sick. I mean, short of breath, chest pain, those kinds of things. So I think they're trying to come up with that balance right now. I don't think testing everyone's probably the right answer.
Additional questions, please. This is your chance. Any other time it costs a ridiculous copay. Fire away.
So if a college student arrives home, as mine just opened the garage door,
hypothetically,
perfect timing, and has been in an area where there's more cases than there are here, is there anything specific to do? I mean, I can't imagine he needs to be isolated, but should we just be aware?
I would be aware, and I would stay 6 feet away from them, and except for maybe the initial hug, and wash hands, wash surfaces. And if he comes down with any symptoms, then especially if you're living with other people, it might be good to know if he has it. That way you could get masks for him and for you guys in the household. One of the recommendations for prevention, because a lot of us will likely end up with people in our households that are sick or at least ill with COVID-19, is that that person stays in a room by themselves and preferably uses a bathroom by themselves and wears the protective mask, not the respirator one, but just the regular protective mask. And that if you have to go in and interact with them, that you wear a protective mask. So it might be worthwhile to know whether they have it before you go purchase that kind of equipment or have that much isolation for that, your husband or your child.
Great. Other questions that may be on your mind or on your heart at this uncertain time? Well, I'm so grateful to everyone who has joined us this evening. I'm so grateful to you, Dr. Reibach. Thank you for joining. Thank you for answering questions. Thank you for everything that you and your organization are doing to keep people safe. It really is an uncertain time where there is lots of news, lots of noise, lots of emotions wrapped into these conversations. The reality is we as Americans are adjusting to a new normal. That's certainly true for those of us working just about every industry, whether you're working with kids or in schools or in healthcare, whether you are working at an hourly or salaried rate, we're all trying to adapt to a new reality. And I think the opportunity to come together to ask real questions, to stay connected and connecting is going to be so, so important. There is illness that comes from picking up the physical symptoms, and we know that there are also mental health challenges to the social isolation that we're all about to face. Please take opportunities to connect with those in your orbit, though you can't offer them a handshake. You can use these times we have together to be making phone calls, to be sending texts, to be checking in on particularly vulnerable populations in your orbit. We are all in this together, and it could be something of a long road. Thank you all for joining.